sat down. Come.
Yes,
And I want to ask people in would you like to answer my first question? Then we have our...
yes, as far as I understood, you asked me whether I chose immunoglobulin for those with secondary recurrent miscarriages and the lymphocyte therapy for those with primary recurrent.
That's right.
Yes. For the time being, I cannot give you lymphocyte therapy because our blood bank cannot deliver the cells. So we have chosen to give also intravenous immunoglobulin to the patients with primary recurrent miscarriage, although our previous studies have not shown any effect. But we start in these patients before they become pregnant, and we combine it with prednisone. And I think, but I agree, we have no good documentation that to start before conception and combine it with prednisone until week 7. We have had patients with 10 and 11 miscarriages, primary miscarriages that have had both. But now we have concluded our study, randomized controlled study, with the secondary recurrent miscarriage. It stops now here in April, and then I think we will start a new one using in the patients with primary recurrent miscarriage, testing combination of prednisone and immunoglobulin and starting before conception. So that is our next trial. We'll start.
I think we have to wait for his trial for a long time. I'm very happy that we have confidently started something. We have good results like what you showed, but this was not a randomized placebo-controlled trial, and therefore we will have to remain scientific like what he is, how you will need an institution for all this. So I'm glad that if you said foundation and you get more friends and you do more cases and you have more scientific information, then it's also a problem that in private practice it's difficult to get placebo controls. And in a big institution in Denmark, they don't charge the patient at all. So they are able to do some of the studies which we may find it difficult. There are two, three more questions, but I would like Dr. Hinduja to ask how, whatever she feels like, because this implantation failure is a big problem, and how much experience do we have? Indira, would you like? And Dr. Rishikesh Pai, another IVF person here.
I just want to know what is the role of intralipid, because we found intralipid before doing the ovum pickup and after the pickup, and after she conceived 3 dosage within 14 weeks of the pregnancy. Well, I don't know how it works because it's not anything to do, it's just an amino acids, but it really works well, one. Second, we have found quite number of times the real reaction to immunoglobulin. So we are a bit scared to give immunoglobulin. Steroids, that is prednisolone with intralipid and with heparin, low molecular weight heparin, we heard that, we seen that implantation rate is definitely good as compared to placebo when we don't give anything. So I just want to know the role of intralipid.
Yes, I did not speak about intralipid because I have not seen any real treatment trials on this. I have seen some comparisons, some study where they have compared changes of NK cells in patients who had intravenous immunoglobulin and patients who had intralipid, and they concluded that the changes were the same. But I have never seen any really test of the treatment efficacy and compared with placebo or nothing. So I think it's a very early stage so far with intralipid. So therefore, I have no opinion about it.